Hey, Joe Zarzaur here with another segment on our COVID update. We're in the 5th month of this stuff. We started in mid-March or so, and we obviously all have been in a remote working situation with Zoom and other stuff. And then in the last month or so, we've actually progressed to a testing regimen in the office that was organized by Dr. Malone. And as we spoke with Dr. Bailey last week, the person in charge of the testing company, or that runs the testing company for our area rather. She's been doing some in-house testing on our staff, those that are not at high risk, and we've been managing the process that way. We found a asymptomatic carrier that we isolated immediately 2 weeks ago. She still has no symptoms. We're gonna test her again on Monday morning, and of course a safe way. And then we're gonna test the entire staff again on Monday morning and see where we are. Hopefully we're all still negative, and I hope that one asymptomatic carrier is negative this time so we can bring her back into the office. Of course, we're all masked up and staying 6 feet away, and we're not letting the public in for the most part to the office, with a few exceptions if they're masked, and we stay 6 feet away from them and we clean up after they leave. So we've created somewhat of our own ecosystem slash sterile environment, I guess you'll say. And then with the help of Dr. Malone and Dr. Bailey, this testing stuff has allowed us to get a little more office feel to our work, which has been great. The way we've been doing these videos since the first month or two was we've come on and done updates when we felt like there were significant events that have occurred. And today we had a significant event locally in that our percent positive, Dr. Malone, was the highest it's ever been. Is that right?
Yes, since they've been reporting it prior to today, I think July 1st, we were like just over 19% for the daily reporting. And today we were 19.9. So 1 in 5 people being tested are coming back positive, which, that's not good. So even if you only tested 5 people, know that one of you guys has it, and then expand that out when you're testing 1,000 people. That's why you have 200 people popping positive with today's release.
Yeah, so to put it in perspective, the communities under the CDC guidelines that can open safely are single-digit percent positive communities. So we are in double digits and pushing into the 20s. So we are a long way away from the CDC guidelines for opening up. And school is starting for a lot of people in the next couple of weeks. So my hope is we draw that number straight down. What is the trend looking like as far as this past week for percent positive, Dr. Malone?
Let me pull that up and share with you here. So visually, you can look at the release from today where they do track back and show the last handful of days. Oops, let me go to the next page. So here's the percent positivity, folks. So today's all the way to the right, the 19.9%. So over the last week, we've been as low as 9%, and then up to 19.9 today. So I guess if you were to spitball average that, I would put us right around 13 or 14%, just these looking at this segment of days here overall, which still is not great. Again, you want to be single digits. What I can show you then, in addition to that, is the log that I've kept personally since the start of this. So you look back here, this is the percent positivity is this third column. And the first, in March, 1%, 2%, we had a 19% pop up on there. That was an isolated day in March. And then again, back down to the single digits for many, many, many days until we come into July here, where we've been living in the double digits from June and July, 10, 11%, 17%, just kind of randomly looking here, and none of them look great. And when I saw this number today, I got a hold of Joe right away and said, this is not good. This is not the direction we want to be going in. I know that there's the talk in the community about, should we be masking or not? And we really need to be doing everything we can in our control, like masking and physical distancing, and really thinking about, do I need to be seeing people in groups or whatever? And and I guess now is not the time to say, look for the loophole of, well, we didn't have, so many people. We had 49, not 50 people or whatever. We had two groups of 40, not one group of 80, that kind of stuff. Cause that's really not the healthy way to go about this.
So here's the part that I don't think people think about unless you're actually confronted with the scenario. But let's just look at the situation we had in the office. We had a healthy looking young person that works here who had no signs or symptoms and wasn't around risky type people. She tests positive. And for the last 3 weeks, she has not shown any symptoms at all.
Yep.
So imagine you are around people every day who could be carriers for the virus and you have no idea.
Yep.
They don't have symptoms ever. They don't feel bad. They're not around people that are sick. They end up catching it somewhere and then they're doing everything right after that, perhaps, and they just don't get symptoms. If somebody never gets symptoms, you never know they have the virus. And they can carry it, we've heard, up to 30 days or more. So without symptoms, that person's called a super spreader, where no symptoms, they don't know they have it. Well, she does in our situation because we tested her. But had we not tested her, it's pretty close to guaranteed that she would have spread it to somebody in the office if she would have been back in the office after being positive.
And I think that there's people that have different degrees of, how at risk they are with, physical health to I guess, contract the disease and feel poorly from it and not be asymptomatic. So, there's a potential that, a handful of people in the office would have come up ill and would have been rendered at home because A, they had the virus, and B, they felt poorly.
Right.
So yeah, that's the scary part. And, you brought up a good point. I wanted to show this real quick here. And I know we shared this earlier today, but this is one of the studies that came out where they're saying that viral shedding in this community that they closed community that they followed, viral shedding was the same between the people who were sick and the people who were not sick and were asymptomatic carriers.
So in other words, they're just as contagious. Let's use simple terms.
Exactly. Okay. So right here, they're saying between symptomatic and asymptomatic patients who were isolated, they followed them, they each shed the virus or were contagious just the same. And so the scary part is that you have an asymptomatic person who's not in a contained system like in this study, who's out and about in the community, potentially spreading it to people who are at higher risk for getting the illness and having some physical manifestations and feeling poorly.
They could be the kind of person like Louis Gohmert, the representative from Texas that was refusing to wear a mask, right? Because he felt fine. Well, it turns out he was supposed to be with the president and they had to test him and he tested positive for the virus. So you may think that you're fine and you don't need a mask because you feel great and you haven't been around anybody and you don't think it's going to get you, but you actually may have the virus. So you may be part of the problem.
Yeah. Well, so the other thing I kind of wanted to say, so there's people out there saying, how bad is it if you get it, and you just have a headache and, and it really I hope that's all it is. And a lot of us hope that. But along the same lines, they're coming out with studies that are showing that there is long-lasting cardiac inflammation. If you look at this, 78% of patients who they followed had some ongoing myocardial inflammation. The myocardium is the muscle, it's the workhorse of the heart. And they had ongoing inflammation of the heart for a period of time after they had the virus.
And that study is from JAMA?
JAMA, yeah, and it just came out last week. So, you can see their last sentence. These findings indicate the need for ongoing investigation for long-term cardiovascular consequences, meaning we don't know. And to see that something is rendering inflammation to the heart muscle is really not reassuring to me that, hey, it's just a headache and a cough and then it goes away and you feel better. There are complications with viruses that can render you to the point where you have heart failure or other illness with the heart that you could not survive or you could require cardiac transplant or you name it. So, it's not as innocent as a lot of people are saying. And so that's the endpoint scary of like, wow, maybe I should just wear a mask. Like, I'd hate to be in the position where I'm the one with the inflammation of my heart muscle.
Right.
So,
all right. So we're going to post that article down below this blog,
Yep.
video
Mhm.
vlog.
Yep.
All right. And then what else do you have today, Dr. Malone?
Let me see if I have one other thing that I was going to show on here. Let's see. I think that was
And while you're
basically,
doing that, I wanted to point out
yeah,
that there's two kind of testing now, and I think the governor of Ohio, I'm forgetting his name right now, DeWine, is that his name?
DeWine,
DeWine.
Mike DeWine.
Thank you. Governor DeWine yesterday was supposed to meet President Trump on the tarmac because President Trump was flying into Ohio, I think Cleveland and a couple other cities to do some campaigning stuff. And DeWine, of course, everybody that comes in contact with the president has to get a test, right, within, I think, that same day. And DeWine did the rapid test, which is, I think, the blood prick of the finger. And they put
Antibody,
in
yeah.
a pregnancy test looking thing. And then it says yay or nay really quickly, like within 15 minutes. Well, he tested positive under that. I'm sorry. Yeah, he tested positive under that test. And then he went, so he couldn't see the president. That afternoon, when he was back at the Capitol, I guess, he went over to Ohio State Medical Center. Well, you certainly can speak to that, Dr. Malone.
Mm-hmm.
And he had a different kind of test. He had the PCR test, which is the one where they take the swab from your nasal cavity and or your mouth. And that one takes a little longer, but it's more reliable. Then I heard today he did that again today, that same PCR test today. And both of those were negative. And it illustrates a point that the test that's being done with the pricked finger, that's a rapid result, has a lot of false positives and negatives. So it's not very reliable. And I've heard that from more than just Governor DeWine's situation. Evan had pulled some studies 2 weeks ago that said pretty much the same thing when we were trying to figure out what should we do with the staff. Should we send them all to ProHealth or some other place that does the rapid testing? Or should we bring Dr. Bailey into the office and have her do the PCR test in the nose and the mouth? And so we opted for the PCR. And then during the 2-week interval, we're doing the rapid test for people that we think maybe have an acute infection or that for whatever reason didn't get captured in our other test. So that's where we are. I just wanted to highlight there are some differences in those tests, just in case you're looking at doing that. If you have questions about that, we'll be happy to answer offline. Dr. Malone,
Yeah.
what was the other thing you wanted to share with us?
So it was a pretty good masking article that I saw in Consumer Reports. Obviously not a scientific a journal of any sort. So it's written to be easily consumed, and they've updated it since April. But it goes through the steps of choosing a mask, and I only bring it up just because in my coming and going from the office and masking and all that, I see people that have masks on that really don't fit, or it's down under their chin and they bring it back up and they're touching the outside of it and all that. And it's just a good reminder of, if you're going to go through the exercise of wearing a mask, I think doing it right. So it's pretty good descriptors that anybody can follow. It's none of this like scientific, oh, you need to have this certain grades of the fibers and things like that. But it tells you, when you're putting your mask on and off, coming and going places, washing is just as important as wearing the mask as well. So it's just a good reminder. So we'll share that as well. There's nothing new in there, but it's just stuff that I recommend people to kind of adhere to if you're going through all those steps.
One of the other things I also read yesterday was that the masks that have the valves, they don't necessarily, they help, I guess, filter air coming in, but they don't filter air going out. So you've seen the masks that have the little round valve things on them. They actually allow your particles to go out, the little valves. So they don't do anything to protect other people from you. They just filter air coming in. So you might want to steer clear of that type of mask, because you're only doing 50% of the job with that versus just cloth, well fitted.
Yeah.
Cloth.
Well, and now that you brought that up, I saw that, one of the advertisements for those masks was the valves, and it was, oh, it lets your carbon dioxide out so you're not rebreathing.
Right.
And just so people understand, there is no way with this mask that you could rebreathe enough carbon dioxide to make yourself like
Toxic.
what they call hypercarbic.
Right.
So that's not going to happen. That happens in a closed system where it's contained air. So that will not happen with a mask with or without that little valve that's on the side. So I wouldn't buy a mask with a valve on it just because you think, oh yeah, I'm not going to retain my CO2 now.
Right.
So ignore that point. That's a selling point with whoever's peddling these things, but it's not
Absolutely.
scientific.
Yep. All
So,
right. Well, Dr. Malone, thank you. I hope this percent positive goes down next week.
yep.
If it doesn't, we'll be back online with another update. You can find us on the web at zarzaurlaw.com or call us at 855-HIRE-JOE. We appreciate Dr. Malone spending time with us this afternoon. Thank y'all very much and stay safe, mask up, and keep your distance.
See y'all.